Would you like to know how I treat sensitive skin or sensitized skin? If yes, then this video is for you. So basically, sensitive skin, the fault is in the skin repair barrier, which is more injured, which is more broken and disintegrated. So the moisture inside is cannot be held up, and the environmental pollutants come in and penetrate into the skin and react to much, leading to an inflammation and a sensitive and a irritable or a reactive skin. So when I treat my patients with sensitive skin, I go very slow. I graduate them from very angry and a very non-reactive, a reactive kind of non-behaving properly kind of skin to calm skin, and then from there I make it robust, and then from there I make it very of a very superlative quality. Now this all thing I have to keep in mind that it has to go very slow, because any one of the ingredient, if it is not agreeing with your skin, will react back if a very aggressive approach is followed. So how I do is I break up my treatment in 4 weeks. In week 1, you go with face wash, very gentle, fragrance free, paraben free. You can pick up from Cetaphil, Bioderma, Sebamed. These are the brands in which you can use the face wash, again non-acidic based. Then after that you use a moisturizer, ceramide based, again very gentle, non-fragrance based and non-paraben containing. And the third one is we use a topical cortisone or a topical steroid, because the inflammation in a sensitive skin is quite a lot. It is underneath in the second layer of the skin, and that's what we need to calm it down. So topical steroid has to be added in the stage 1. This goes on for 1 week. This entire combination of these 3 products will settle the skin will look less angry, and the skin will start looking a little more drier, sometimes because the inflammation takes time. After the first week, we go on to the second week. In the second week, we are very cautious to use makeup, so that we use very simple makeup removing products like Sensibio O2 or micellar water, and these products like these will ensure that the makeup is removed gently. Pick up good product, good quality makeup. Make sure the makeup is removed before you go off to the sleep at night, and any ingredient in the makeup shouldn't react back. So in the week 2, we use makeup removers, and next is the sunscreen. Sunscreen again more than 30 SPF, because the skin is already sensitized. Make sure you use a mineral sunscreen. You can use a tinted sunscreen. Apply it every 3 to 4 hours, and again fragrance free and paraben free sunscreen. Let this combination of, now you have 3 products and another product with the sunscreen. So 4 products you continue for another 1 week. Post that, the skin will almost look much normal, but may have little redness, or sometimes the skin is absolutely looking normal. Our next motto is correction. Now correction means we now need to correct the problem behind all of this. So the barrier which is disintegrated or it is injured, we have to build it up. So barrier building combinations or formulations which have ceramide, which have niacinamide, have to be added. So creams which help to build up the skin, which help to protect and repair the skin back, are extremely essential, because now we are going in for a normal looking kind of a skin and making it more robust and strong. Let this entire combination be there for about 1 week more. And now in the 4th week, now is the time to add the additives or the actives. So actives are concentrated products which help the skin to get into a more superlative zone. So the skin starts looking more shiny, it's almost normal, it's going to look now radiant. And how do we do that? Is by adding products like azelaic acid, which is again an anti-pigmentation, anti-aging, anti-lightening, and of course anti-inflammatory. So azelaic acid, next is niacinamide, which is again strong anti-inflammatory product, and then of course not the least is our retinoic acid. So retinols basically, or retinoldehyde, so use a very low potency one and use a much lower formulation. So lower the formulation of the vitamin A or the retinoic acid, which is retinaldehyde, you can use that. Or maybe even if you're using retinol serum, then use a very low concentration. Use it only once a week or maybe only twice a week. And then this is how we start working up on the skin to make it much more superlative. So did you see the entire program of settling a sensitive skin from year to year takes about 4 weeks. So first week few products, second week few products, see for how it's calming down. If you're fine, then the third, and once everything settles, the skin is strong and nice, then we graduate you to the fourth week, and you just maintain with this kind of a flow. So hope this entire video was helpful for people with sensitive skin, and more about barrier repair in the next video. See you.